Height reduction is one of the surgical procedures that has seen a renewed demand in recent years. And concerning height reduction, I'd like to begin by stating the following. These patients are typically already individuals of a larger build. And I always make sure their weight isn't excessive because it prolongs the surgery duration, extends the wound healing process, and makes their getting up and walking, their early ambulation, much more difficult. So I want their weight to be in ideal conditions for their height. If they are overweight, I prefer to postpone the surgery. That is why body weight is important, and the same applies to height reduction. Proportion is key. In most cases, I perform a maximum shortening of about 4 to 5 centimeters on the femur. That is why I always tell patients to pay attention to these limits. Before surgery, I ask them to request shortening in a way that does not disrupt the balance between the legs on the height chart. Height reduction surgeries generally allow for a shorter recovery period compared to height lengthening procedures. That is why I tell patients to pay attention to these limits. This is a very important point. Before surgery, I ask them to request shortening in a way that does not disrupt the balance between the legs on the height chart. When this is followed, we can perform the procedure. Height reduction surgeries generally allow for a shorter recovery period compared to height lengthening procedures. We start allowing partial weight bearing very early, followed by full weight bearing. However, due to muscle imbalance, unsupported walking can be difficult in the early period. In most cases, patients are able to start walking without support after the 3rd month, or they start walking with a single crutch. But here the most important thing is to quickly correct the imbalance in the existing muscles and soft tissues, and by strengthening those muscles, they need to understand that there's a long-term rehabilitation process ahead. Well, in height reduction and height lengthening, these are quite extreme surgeries, and here the most crucial aspect, even more so than the surgery itself, is the patient's ability to diligently work towards adapting to their new stature. And by work, I'm referring to rehabilitation processes that span at least 1 to 2 years. Of course, in the subsequent period after the first year, instead of physical therapy, they need to continue with sports activities to maintain their current physique, their muscles, ligaments, joints, and adaptation processes. Rehabilitation is also very important in height reduction.